Dr. Denton here, and I wanted to tell you a little bit about this awesome event that we got to be a part of back in September. Every year, every other year, there's an event called the North Carolina Missions of Mercy Clinic. And it's actually really amazing that it comes to our community here. So the community care clinic here in Salisbury does a great job of bringing together dentists from all over the place to come in for a couple of days and provide dental care to patients that otherwise wouldn't have access to it. So this is an event obviously that's in high demand. There's a lot of patients out there that need dental care, cleanings, fillings, and even crowns and things like that. Not my area so much. But at any rate, there's lots of patients that need it. And the mom clinic really fills a void in our community. I really thought about how Salisbury Eyecare and Eyewear could be helpful at the mom clinic, since we're eye care people, not dental people. And what I came up with was, just providing vision screenings outside of the doors. Those people have to wait in line for a long time, sometimes all day, waiting for dental care. And I thought that we could provide some value by being out there, kind of give them a break from what they were doing and check their eyes while we were at it. On my way to the Missions of Mercy Clinic today. We are going to do vision screenings, and it's going to be awesome. We screened the patients, we took a history, we checked their vision, visual acuity, we looked at their pupillary reflexes and their extraocular motility, just basically the way their eyes were moving and working together. We did all the things we do in a regular exam, except do the refraction for glasses. What are we doing?
We're doing vision screenings today.
Good. Also dilated when necessary, when the history warranted that, and when my exam findings warranted that. I brought my BIO, that's my binocular indirect scope, as well as some other equipment so that I would be able to look in the back of the eye. And it was awesome. We took blood pressure, we identified some patients with high blood pressure and found them, recommended places for them to go. How many patients have we seen so far?
We've seen about, actually I'm numbering, we're on number 22.
Oh, good.
So we've seen 22 patients, and a lot of them are very appreciative that we're here.
Awesome. Tell me how it's going.
It's going great.
So at the end of it, we'd seen between 25 and 30 patients. Most of them hadn't had eye exams in a very long time. Most of them were uninsured. I think maybe 2 people had insurance, but other than that, we were seeing patients who, really didn't have access to eye care. And a number of those patients had high blood pressure. A number of them had diabetes, and I was able to dilate those patients and look at the back of their eyes. Some of them for the first time in a long, long time. So it was a really successful day overall. We had a great time. We screened a lot of patients, and we just love doing things like that. Anytime I have the opportunity to bring my team to an event like that and do some good for the community, I think it's all just a win-win situation.